Bachelor of Science Nursing Microbiology Unit 4, Immunity, Types and Classification. Definition: immunity is the body's ability to recognize and defend itself against harmful pathogens such as bacteria, viruses, fungi, and toxins. It is achieved through a combination of defense mechanisms that protect the body from diseases. Types of immunity. Immunity is broadly classified into innate, natural immunity, and acquired, adaptive immunity. Innate immunity, natural or non-specific immunity. Definition: this is the immunity that an individual is born with. It provides the first line of defense against infections. Characteristics: present from birth. Acts immediately against any pathogen. Lacks specificity and memory. Involves physical, chemical, cellular, and physiological barriers. Components of innate immunity. Physical barriers prevent entry of pathogens. Skin. Intact skin prevents microbial entry. Mucous membranes line respiratory, gastrointestinal, and genitourinary tracts. Cilia trap and remove microbes from respiratory tract. Chemical barriers destroy microbes. Lysozyme in tears and saliva breaks bacterial cell walls. Gastric acid destroys swallowed pathogens. Interferons, proteins that protect against viral infections. Complement system, a group of proteins that lyse pathogens. Cellular components engulf and kill microbes. Phagocytic cells, neutrophils and macrophages ingest pathogens. Natural killer, NK, cells destroy virus-infected cells and cancer cells. Physiological barriers. Fever inhibits pathogen growth. Inflammation increases blood flow to infected areas for immune response. Acquired immunity, adaptive or specific immunity. Definition: this is a defense mechanism developed during life after exposure to a pathogen or vaccination. Characteristics: highly specific to particular pathogens. Develops after exposure to antigens. Has memory, providing long-term immunity. Involves lymphocytes, B cells and T cells. Active immunity. Natural active immunity occurs when a person is exposed to a disease and develops immunity, e.g. chickenpox. Artificial active immunity. Immunity developed through vaccines, e.g. polio vaccine. Passive immunity. Natural passive immunity. Transfer of antibodies from mother to baby via placenta, IgG, and breast milk, IgA. Artificial passive immunity. Injecting preformed antibodies, e.g. antivenom for snake bites. Active immunity. Definition: active immunity refers to the protection developed by the body after exposure to an antigen, either through infection or vaccination. The immune system actively produces antibodies and memory cells, which help provide long-term or lifelong protection. Characteristics of active immunity: long-lasting or lifelong protection due to memory cell formation. Takes time to develop, usually days to weeks. Involves direct antigen exposure leading to antibody production. Stimulates both humoral B cell and cell-mediated T cell immunity, boosted through subsequent exposure to the pathogen. Types of active immunity. Natural active immunity occurs when a person naturally contracts an infection and recovers. The body recognizes the pathogen, triggers an immune response, and produces specific antibodies against it. Example: a person infected with measles develops immunity, preventing reinfection in the future. Artificial active immunity. Induced by vaccination, where a weakened, killed, or inactivated form of a pathogen is introduced into the body. The immune system responds by producing antibodies and memory cells, preparing the body for future encounters with the actual pathogen. Example: polio vaccine helps the body build resistance to the polio virus without causing the disease. Advantages of active immunity: provides long-term protection, develops immune memory, preventing reinfection, stimulates a strong immune response. Disadvantages of active immunity: takes time to develop, not immediate, may cause mild side effects, especially with vaccines, e.g., fever, soreness. Passive immunity. Definition: passive immunity occurs when ready-made antibodies are transferred from one individual to another. Since the recipient's immune system does not generate these antibodies, protection is immediate but short-lived. Characteristics of passive immunity: immediate protection, as antibodies is already formed. No activation of the immune system, no memory cell formation. Protection is temporary and lasts only a few weeks to months. Can be naturally transferred, mother to baby, or artificially administered via injection. Types of passive immunity. Natural passive immunity occurs when antibodies are naturally transferred from mother to child. Example: placental transfer. During pregnancy, maternal IgG antibodies pass through the placenta, protecting the newborn from infections. Breast milk, colostrum, contains IgA antibodies, providing immunity against gastrointestinal infections. Artificial passive immunity involves the injection of preformed antibodies, immunoglobulins, or antiserum to provide immediate protection. Example: tetanus antitoxin is given to individuals exposed to Clostridium tetani to neutralize the toxin. Rabies immunoglobulin RIG is administered after a rabid animal bite. Advantages of passive immunity: provides immediate immunity, crucial in life-threatening situations. Beneficial for newborns and immunocompromised individuals. Useful for treating diseases when active immunity is too slow, e.g., rabies, snake bites. Disadvantages of passive immunity: short-term protection, as antibodies degrade over time. No memory cell formation, so reinfection is possible. Risk of allergic reactions or hypersensitivity. Conclusion: both active and passive immunity play essential roles in protecting the body against infections. Active immunity provides long-term defense but requires time to develop, whereas passive immunity offers immediate but short-term protection. Understanding these differences is crucial in nursing and healthcare, especially for infection control, vaccination programs, and emergency treatments.